Hi, my name is Mitsuho IKEDA from Center for the Study of Communication Design, Osaka University. My presentation title is on Japanization process of introduction to harm reduction policy from 1970s to present. Harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also movement for social justice built on a belief in and respect for the right of people who use drug. This phrase is from the harm reduction coalitions. Harm reduction is that meaning. In this, my presentation, the context is Japan is one of the few countries that have not officially introduced the harm reduction policy. The study aims at examining the perception and history about harm reduction among addiction community, those affected by or involved as healthcare specialists in drug problems in Japan. How was the ideas of harm reduction brought to Japan? Study A, there are two studies, Studies A and Studies B. Studies A aimed to clarify this process by literature review. Study B tried to identify the variation of discourse by interviewing method. The idea of harm reduction reached Japan about 30 years ago. Since then, the discussion on these topics has changed from our foreign practice that is only applicable to the countries with severe heroin use problems to detailed argument about whether it can be applied to Japan's situations. So the studies A depicting a brief history of harm reduction in Japan. Depicting a brief history of harm reduction. Harm reduction in history of dependent treatment. Harm reduction approaches began as an alternative that zero tolerance or substance-oriented countermeasures for drug use in 1970s Europe. Later, its effectiveness was widely recognized with the spread of HIV, AIDS, and currently it is being introduced and developed in many countries struggling with drug problems. Descriptions such as these are very commonly seen in academic materials and other resources describing harm reduction approach. However, practice based on the idea of harm reduction are being examined throughout the world as the use of addictive luxury goods such as alcohol, tobacco, and opium spread and generated medical and social problems. Since the 19th centuries, in Europe and North America, maintenance and substitute therapeutic addiction treatment have been used. For example, there were attempts to treat opium addiction with cocaine. In Japan's case, in pre-war Taiwan, it is known that the opium restriction policies was carried out with its main content being the control of opium of the opium monopoly system, the registration license systems of opium uses, and the supply and taxable amount of opium. This wiped out number of opium users by 1945, which had made up as much as 10% of Taiwanese populations. The arrival of the term harm reduction to Japan. In 1983, the Ministry of Health, the AIDS research group was established, and in 1984, the AIDS Survey Committee was established. In 1987, the first AIDS countermeasure ministerial conference has held. At that time, several HIV-related papers had been translated from English to Japanese. The term harm reduction was yet to appear among this literature. However, descriptions of trial practice, such as needle exchange programs, were also appearing. At that time, needle exchange programs had already achieved successful result as an HIV countermeasure in some cities in Europe and North America. However, it was close to 1990s when the term harm reduction appeared in the methodology sections and the term was defined. In English literature from that time period, the term harm minimization was also often used. At this time, when initial information was being collected about HIV through overseas surveys and literature, the term harm reduction came to be known among some Japanese experts as an example of various HIV prevention programs for drug users. In 1994, Japan held to the 10th National AIDS Conference. To participate in the conference, parties involved in harm reduction programs, implementations, advocacies, and research came to Japan and brought a lot of information. Information on harm reduction was brought from overseas surveys and trend carried out by ministries and agencies involved in drug policies. However, in Japan, where the scale of drug problems is relatively small compared to other countries, there are few researchers and practitioners interested in harm reduction. Until around 2010, there were few people spreading information on harm reduction, and these included medical and social scientists involved in international aid. However, in the field of alcohol treatment, discussions began to take place about the effect of starting therapies goes with temperance, controlling amount of alcohol rather than abstinence, and the term harm reduction began to be used. Harm reduction became recognized in literature around 2010 as a movement to examine in conjunction with the status of Japan's drug policy. In 2016, harm reduction was made the theme of a specialized academic conference on addiction and discussion were held on harm reduction practice in Japan's alcohol and drug treatments. So now the time to present of study B, variation of discourses of harm reduction in Japan. We conducted qualitative research, semi-structured interviews targeted to two groups. Group one is in the service users of drug addictions, healthcare, and social services, including drug users and ex-drug users. Group two is the service providers of these services. So healthcare takers, nurses, psychiatrists, etc. For each group, 10 to 12 respondents were recruited by snowballing method. The data was anonymized and transcribed. The method of content analysis was applied in the text data in order to describe the variation of discourse regarding drug use, healthcare, and harm reductions. So, discourses found in interview researches. So there are levels, conforming realities, confusing natural orders of things, a definition of one's own pharmaceutical therapies, joined it in Japan, doing it in Japan. So on the themes of confirming reality, so the discourses is there. Harm reduction is effective. However, in the background lies the reality that the use and abuse of drugs are still extensively spreading to national and local communities. The quote is, the confusing natural orders of things. Even if it is effective, the goal of drug policy should be to be ban drugs, and harm reduction is work the drug policies. On definition of one's own, it is adaptive for the substance use abuses patient to make the period in which they do not use substances in life as long as possible, and this can be the harm reductions. On therapeutical therapies, since drug therapies for stimulants has not been established, harm reduction cannot be used. So the last discourse is drug it in Japan, doing it in Japan. At the individual level, things similar to harm reduction are being done. So I introduce another discourses. Acceptance of those who relapse. It is important to be able to talk about relapse. There is not much meaning in blaming relapse on diversities. Harm reduction leads to the idea that there should be an individual recovery view on things more important. If it is needed to live, then it is okay to use. Safety is necessary prior to drug withdrawal. On avoidance of isolation and connections. Harm reduction connect one to peers and others. On human rights or on humanism, harm reduction is connected to one's natural rights as a human being. So to be continued, the discourse is found in the interview researches. on Japanese style harm reductions. There should be style of harm reduction that can be used in Japan's situations. On enhanced accessibilities to medical care. With the harm reduction ideas, you can increase the number of people newly entered to medical care. Introducing people to medical care is important. Okay, which we moved it to, we will move the general description, introducing harm reductions. Sorry. One, different jurisdictional systems during drug users and their subcultures, cultures of biomedicines, local biologists are also societies. Second, attitude and practice of Japanese import of Western systems. So that means Japanizations. Third, optimist and pessimist views. Both demedicalization and decriminalization and more enhancement of social control. Fourth, how we do medical and health sociologists to intervene into public sphere of users, professionals, and authorities concerned. Okay, brief history, the last sections of a brief history of introducing harm reduction on books. So this is a Japanese editions of Face of Japanese translation of Slaying the Dragon, published in 1998 by William L. White. Variety of addiction treatment trials has been examined from the abstinence movement, self-help groups, therapy communities or therapeutic communities, early methadone treatment to current harm reduction trials. Okay, now this Japanese titles can be translated. Confronting AIDS, published in 1986 by National Academy of Sciences, USA. So this is the translations, no? Published in Japanese in 1988. There is a description of the needle exchange programs. However, the term harm reduction is not used. Okay, this publication is AIDS in the World, published in 1992 by Jonathan Mann et al. Although not translated into Japanese, this was led by many specialists in Japan. Terms harm reduction and harm minimization are listed in the index of this book. So this is very important, the historical discussion on the methamphetamines users. Drug and discourses. Methamphetamine in Japan, published 2006 by Dr. Akihiko Sato. The author is a sociologist. There is a chapter discussing harm reduction as a measure to support European drug policies and social control mechanisms. So this is the edited books. Challenge for New Drug Policies, published in 2007. Edited by Shinichi Ishizuka. Collection of papers by lawyers and recovery support practitioners in Japan. Also references harm reductions. So this is edited book by Toshihiko Matsumoto et al. What is harm reduction, published 2017. Collection of papers by psychiatrists, researchers, and healthcare providers. The first book in Japan with term harm reduction in the title. So from left, a book for those who seek for dark tourism in Europe, published in 2009. Non-fictions on the Dutch Society by journalist, published 1996. And earlier studies, report of Netherlands by the academic, does not use the term harm reductions, but describe the methadone abuses, methadone basis, and drug use zones. So this is the 51st annual academic meeting of Japanese societies of alcohol addictions, medicine of alcohol addictions. Addiction sciences at the viewpoint of harm reductions. Held in Tokyo, October 2016. 668 people attended. 33 lectures were presented with the keyword harm reduction on the problem of drug, alcohol, and tobacco. Among these, 22 lectures reported on the situation of practice in Japan. In the public symposium, considering harm reduction development database from the point of view medical care, recovery support, and legal treatment, held a debate on stage. Others included the symposium, current state of addiction management measures, considering subtitles considering the introduction of harm reductions, and education lectures, general remarks on the treatment of alcoholism from Kurihama method to harm reductions. So my lecture is will be ended. Thank you for your attention. You can access more information about harm reduction by our internet resources in Japan. So it is a two-dimensional code of please refer our information. Thank you so much of my presentation. Bye-bye.